What happens when a healthcare giant decides to shrink to survive?
That's the million-dollar question, isn't it?
It is, and that's exactly what we're tackling today as we take a deep dive into Humana's wild ride through 2024.
Their financials are like a roller coaster with some seriously sharp drops and unexpected turns.
Absolutely, and we've got all the intel you need to decipher what's going on. We're talking official earnings reports and some really insightful analysis from the experts who are watching this story unfold.
This is more than just numbers on a spreadsheet, though, right?
You got it. It's about understanding the forces at play in healthcare and how they might ripple out and impact all of us.
So this deep dive is kind of like your crash course in healthcare economics.
Exactly. You'll be equipped to make sense of the changing landscape of insurance, costs, and care, all through the lens of Humana's experience.
I'm in. Let's get started.
All right, so first, let's set the stage. Humana, a big player in the health insurance world, especially when it comes to Medicare Advantage, just released their Q4 2024 earnings.
And the news.
Well, it's a mixed bag, to put it lightly.
I was checking out their numbers earlier, and it was almost like a paradox. More revenue, but way less profit.
It's bizarre, right? Their Q4 2024 revenue climbed to $29.2 billion, up from $26.5 billion in Q4 2023.
So they're bringing in more cash?
For sure, and for the entire year, their revenue hit $117.8 billion compared to $106.4 billion in 2023. But here's the thing.
The but that always seems to follow seemingly good news.
Pretty much. Their profit for the whole year was basically sliced in half.
Ouch.
Yeah, it landed around $1.2 billion, a steep drop from the $2.5 billion they pulled in back in 2023. And get this, their Q4 actually finished with a net loss of $693 million.
So more money coming in, but they're actually losing more.
Exactly. It's like some kind of financial puzzle.
Well, I think if we dig into the earnings release a bit, the answer might be right there.
Lead the way. What are we looking for?
Keep an eye out for the phrase rising medical costs, especially when they talk about their Medicare and Medicaid members.
So even though their overall income is up, the cost of actually providing health care to their members is eating into their profits.
That seems to be the main culprit.
That makes sense, but it still leaves me wondering, how is Humana responding to this squeeze?
That's where things get really interesting. They're making a bold and some might say risky move. You could even call it strategic shrinkage.
Hold on. Strategic shrinkage. That sounds a bit counterintuitive. What does that even mean?
In a nutshell, they're deliberately scaling back their Medicare Advantage membership.
Seriously, they're choosing to have fewer customers.
They are, and they're projecting a loss of 550,000 Medicare Advantage members by 2025.
That's a huge chunk of their business. I mean, wouldn't losing that many members directly impact their revenue, even if they're aiming for better profitability per member?
It's definitely a gamble, but their thinking is that by shedding those less profitable plans and focusing on a smaller, more targeted membership, they can stabilize things in the long run.
It's a high-stakes move, no doubt about it. But it's not just about cutting back, right? They're also facing some roadblocks in bringing in new members.
Absolutely. They were hoping open enrollment in fall 2024 would bring in a flood of new signups.
Yeah.
It was more like a trickle. It didn't meet their expectations at all, particularly with those folks who lost coverage because their plans got canceled. Many of them didn't come back to Humana.
So they're strategically downsizing, not seeing as many folks re-enrolling as they'd hoped. And they're specifically losing ground with those dual-eligible members, the ones with both Medicare and Medicaid.
That's right. And that last part is particularly worrying, as those members often have more complex healthcare needs and might be more reliant on the support those specialized plans provide.
It feels like there's a big piece of this puzzle we haven't touched on yet, something that might shake things up even more for Humana.
You're spot on. We can't ignore the elephant in the room, their star ratings.
Ah, yes, those quality ratings you see next to Medicare Advantage plans.
Yep, those. And Humana's have taken a real hit for 2025. There's one plan in particular, covering nearly half of their MA members, that plummeted from a 4.5 to a 3.5 rating.
A whole point drop. That's massive.
Yeah.
But honestly, I've never fully grasped how those ratings actually affect things. Is it just about reputation, or do those stars have real-world consequences?
Oh, it's way more than just bragging rights. Those ratings directly impact how much money Medicare Advantage plans get from the government.
Oh, so the higher the rating, the bigger the payout.
You got it. So when those ratings nosedive, their funding takes a hit too.
So we're not just talking about a bruised ego here. This is a direct blow to their bottom line.
You hit the nail on the head. With such a dramatic drop, Humana's potentially looking at a multi-billion-dollar loss in revenue.
Billions. That's astronomical. So they're scaling back their Medicare Advantage program, their ratings are in free fall, and they're staring down this huge potential loss. What's their game plan now? Are they throwing in the towel?
Not a chance. They're fighting back on two fronts in the courtroom and through strategic investments.
A courtroom battle. Now you've got my attention. Tell me more.
They're actually suing the government, trying to get those 2025 star ratings overturned. Their argument is that there could be errors in how those ratings were calculated and that they don't truly reflect the quality of their plans.
Wow, so they're going up against the very system that's put them in this corner. That's a bold move, but is it a long shot?
It's hard to say. Legal battles are notoriously unpredictable, but it definitely shows Humana's not backing down. And they're not just banking on the courts. They're putting their money where their mouth is, investing heavily to improve their operations.
So they're taking a two-pronged approach, fight the ratings in court, while simultaneously investing in making their plans better. Smart. But if they're scaling back their Medicare Advantage program, where are they looking for growth?
Great question. Instead of pouring resources into a struggling Medicare Advantage market, they're shifting their focus to two key areas, Medicaid and CenterWell, their primary care division.
Well, that's their foray into actually providing health care, right?
Yeah.
It seems like a lot of insurers are moving into that space these days. What's the reason for that trend?
There are a few factors at play. Owning and operating primary care clinics gives insurers like Humana more control over costs and the quality of care their members receive. They can streamline things, make sure patients are getting preventive care, and better manage chronic conditions.
So it's a strategic move towards more direct involvement in healthcare delivery, rather than just being the payer on the sidelines.
Precisely. And it aligns with the industry's push towards value-based care. By focusing on primary care, they're aiming to keep people healthier, prevent those expensive hospital stays, and ultimately bring down overall costs.
It's like a proactive approach, catching problems early on before they escalate into bigger, more expensive issues. But what about Medicaid? Why are they betting on growth in that market?
Medicaid is a fascinating space right now. It serves a massive and ever-growing population, and there's a lot of opportunity for insurers to step in and manage care for those beneficiaries.
So they're seeing potential in a market that often gets overlooked or even stigmatized.
Exactly. And Humana, with their experience managing complex populations, like those dual-eligible folks we talked about earlier, might be uniquely positioned to thrive in the Medicaid market.
So while they're shrinking in one area, they're looking to expand in others, almost like they're reshuffling their portfolio, hedging their bets in the healthcare arena.
That's a great way to put it. It reflects just how dynamic and unpredictable the healthcare industry is. What's a sure bet today might be a flop tomorrow, and companies like Humana constantly have to adjust and adapt to stay ahead of the curve.
So to recap, Humana's profits are down. They're strategically downsizing their Medicare Advantage program. They're facing major hurdles with their star ratings, and they're fighting back with a lawsuit and strategic investments. It's a story with a lot of twists and turns.
It really highlights the challenges and opportunities in the healthcare industry right now.
Humana's story is just one example of how insurers are grappling with rising costs, regulations that keep changing, and consumers who are becoming more and more demanding. But how does all this impact the average person, someone just trying to make sense of healthcare and pick the right plan for themselves and their families?
That's the question we're going to unravel next.
Stay with us as we unpack the wider implications of Humana's roller coaster year and what it might signal for the future of healthcare in America.
It's kind of striking, right? Humana's going through all this, but they're not alone. The entire healthcare industry seems to be facing some serious hurdles.
Yeah, you're right. Costs are going up everywhere, and the rules and regulations are constantly changing. It's a lot to keep up with. And then you add in the shockwaves from that United Healthcare executive's murder back in December, and it just underscores the pressures in this industry.
It really does. It was a stark reminder that these challenges aren't just numbers on a balance sheet. They have real-world impacts, and sometimes those impacts are tragic.
It's true. So with all that going on, how does Humana's performance in Q4 2024 actually stack up against the other big players in health insurance? Are they an outlier, or are they just part of a larger trend?
Well, luckily we've got some data to help us compare. We can see how Humana's doing relative to others like Elevance Health, Molina, Oscar Health, and the giant United Health Group.
Okay, let's start with revenue. Yeah. How did Humana measure up there?
Their Q4 revenue came in at $29.2 billion. That puts them somewhere in the middle of the pack.
Not too shabby.
Yeah, but they're definitely dwarfed by companies like Elevance, which brought in a whopping $45 billion, and United Health Group, which was way out in front with $100.8 billion.
Okay, so not the biggest, but not the smallest either. Somewhere in between on the revenue front. But revenue is only part of the picture. What about profitability? Humana actually ended the quarter in the red.
They did with a net loss. And it turns out they weren't the only ones. Oscar Health also reported a loss for Q4.
So some are weathering the storm better than others.
It seems that way. Elevance, Molina, and United Health all stayed profitable in Q4.
Interesting. There's one more metric I'm curious about, the medical loss ratio, or MLR.
Ah, the MLR. It's a key indicator of an insurer's financial health. It shows what percentage of their premium income they actually spend on healthcare claims and quality improvement activities.
So a higher MLR means they're spending more on actually taking care of people, and a lower MLR means they're keeping more for themselves.
Basically, yeah. In Q4 2024, Humana's MLR was 91.9%.
Okay, and how does that compare?
Well, it's higher than both Oscar Health at 81.6% and United Health Group at 88%, but it's lower than Elevance, which was at 92.4.
So again, somewhere in the middle, their MLR isn't the best, but it's not the worst either. But let's go back to that strategic shrinkage idea for a minute. They're deliberately losing customers to try and become more profitable. Is that a sign of strength, the company making tough choices to secure its future? Or is it more of a desperate move, company flailing as it tries to stay afloat?
That's the big question, isn't it? It's got analysts and experts all over the place. There are strong arguments on both sides.
Okay, let's play devil's advocate then. Let's start with the argument for strength. How could shrinking intentionally be seen as a positive thing?
Well, you could argue that it demonstrates adaptability and a willingness to make hard decisions. Humana is acknowledging that the current market dynamics just aren't working for them, and they're making changes.
So it's a strategic retreat, not a surrender.
Exactly. They're prioritizing long-term sustainability over those short-term gains.
I can see that perspective. But what about the desperation argument? How could this be a sign of weakness?
Some might say it shows they just can't compete effectively. They're admitting they can't win in the Medicare Advantage market, at least not at their previous scale.
Instead of fighting to keep those members, they're raising the white flag and retreating.
Some might see it that way, yeah. And those star rating challenges and the looming funding cuts definitely add weight to that argument.
It's a vicious cycle, isn't it? Ratings down, potential funding cuts coming, further pressure on profitability, and that just makes it even harder to turn those ratings around.
Exactly. It's a risky maneuver, no doubt about it. If they streamline operations, improve those star ratings, and focus on more profitable areas, it might pay off. But if it backfires, well, could be a downward spiral.
It's a big gamble.
Yeah.
So even if Humana manages to turn things around, what does it all mean for the people who rely on these plans? What are the implications of these lower star ratings, shrinking networks, and all this industry upheaval?
That's the most important question, right? At the end of the day, these aren't just business decisions. They affect real people's lives and their access to healthcare.
Okay, let's break it down. First, those lower star ratings. We've talked about how they impact Humana's funding, but what do they mean for the folks enrolled in those plans?
Unfortunately, lower ratings often mean fewer benefits and higher out-of-pocket costs for consumers. Things like higher copays, deductibles, and even restrictions on which medications are covered.
So if your plan's rating dropped, you could be paying more for healthcare, even if you're not using it any more than you were before.
It's a tough reality. And it's not just about money. Lower star ratings can also reflect problems with quality of care, customer service, and access to providers.
So it's not just about cost. It's also about the potential for less comprehensive care or more difficulty getting the care you need.
You got it. That's why those star ratings are so important when you're choosing a plan. Don't just go for the lowest premium. Look at the whole picture and how it might affect your overall healthcare experience.
Healthcare decisions are complex, and we need to really do our research.
Absolutely. And don't forget about the impact of Humana's shrinking footprint. As they pull out of some markets and narrow their networks, some people will find they need to switch plans or even providers if Humana is no longer an option.
That can be really disruptive, particularly for those with chronic conditions who have a long-standing relationship with their doctor.
It's hard to start over. That's why staying informed about changes in healthcare is so crucial. Don't assume your plan will stay the same year after year. Review your options during open enrollment, compare carefully, and don't hesitate to ask questions and advocate for yourself.
Be proactive, informed, and ready to ask questions. Good advice. But playing devil's advocate again, could there be any silver linings to Humana's struggles? Could this industry shakeup actually lead to innovation or positive changes?
That's a thought-provoking question. It's possible that Humana's situation might actually force some broader industry reform.
How so?
Well, Humana's challenges are kind of a symptom of deeper problems in healthcare. Rising costs, regulatory pressures, the fragmented nature of care. These are systemic issues that go beyond any one company.
So Humana's struggles are like a warning sign, a signal that something needs to change.
Exactly. Sometimes it takes a crisis to make people confront those underlying problems and search for new solutions.
So Humana's situation, tough as it is, could be a wake-up call for the industry, showing that the current system isn't working and needs a serious overhaul.
I think so. And it's not just about fixing what's broken, it's also about embracing new ideas and making improvements. We're seeing exciting advancements in healthcare, from telehealth and virtual care to the incredible things happening in personalized medicine and data analytics.
So even amidst these challenges, there's a sense of hope, a sense that we might be on the verge of a new era in healthcare.
I believe so. It's important to remember that healthcare is ultimately about people. It's about making sure everyone has access to high quality, affordable care.
It's about improving lives, empowering people, and building a system that genuinely meets people's needs.
Exactly. That's why these conversations are so crucial. Examining the challenges, exploring possibilities, and working together to make healthcare better for everyone.
All right, on that note, let's shift gears for a bit and talk about something that's creating a lot of buzz in healthcare consolidation. We're seeing hospital mergers, health systems expanding, and now maybe even insurers seeking safety and size.
It's a trend with both potential benefits and drawbacks. Some people see consolidation as a path to greater efficiency, streamlined operations, and ultimately lower costs.
The idea being that bigger is better, at least from a business standpoint.
Right. But others are worried that consolidation will stifle competition, limit consumer choice, and lead to higher prices in the long run.
It's that classic trade-off, efficiency versus competition.
Exactly. And it's a tough one. There's no easy answer.
So how do we strike that balance? How do we ensure consolidation leads to a better, more affordable system without sacrificing quality or choice?
That's something policymakers, industry leaders, and consumers need to figure out together.
It's a conversation that needs to happen everywhere, from the boardroom to the doctor's office to our own dinner tables.
You're absolutely right. And consolidation's not the only factor. We need to consider technology's role, the move towards value-based care, and how the needs and expectations of people using healthcare are changing.
It's a complex problem with no easy answers. But one thing's for sure, healthcare is in a state of change, and we're all along for the ride.
It is a wild ride for sure, and it's crucial that we stay informed, engaged, and empowered to navigate those twists and turns ahead.
Well said. But back to Humana for a second. They're going through all this, and they're trying to make a comeback. But healthcare is heavily influenced by politics. Every election, it's a battleground issue. How does that uncertainty affect companies like Humana when they're trying to plan for the future?
Oh, it's a huge factor. Political uncertainty is like a wild card in healthcare. Changes in laws, regulations, even just the rhetoric around healthcare can have ripple effects throughout the entire system.
It's like trying to build a house on shifting sand.
Perfect analogy. And it's not just the federal level. State level policies play a big role too. Different states have different rules, different Medicaid programs, different ways of handling things like telehealth and drug coverage. So insurers have to navigate this crazy quilt of regulations, adding another layer of complexity.
It's no wonder companies like Humana are struggling to find their footing.
It is a very challenging environment, but it shows how important political engagement and advocacy are. Insurers can't just sit back and hope the political winds blow in their favor. They need to be shaping the conversation, educating policymakers, and advocating for policies that create a sustainable and equitable healthcare system.
So it's about being more than just a business. It's about being a responsible player in a system that impacts millions of lives.
Precisely. And that responsibility extends to all of us. We all need to be part of shaping healthcare's future.
I'm on board with that. Let's shift our focus away from politics and towards something more concrete. Humana's plans for improvement. They've mentioned investing in operational excellence and boosting those star ratings. But what does that look like on the ground? What specific steps can they take to reach those goals?
Good question. We don't have their internal playbook, of course, but we can look at what insurers typically do when they're trying to improve quality and efficiency.
Let's get into the nitty-gritty. Where should they be focusing their efforts?
First and foremost, they have to control those rising medical costs. That means working closely with providers to negotiate better rates, exploring new care models that are more cost-effective, and investing in preventative care to keep their members healthy and out of the hospital.
So it's about being proactive and tackling the root causes of those high costs, not just reacting to them.
You got it. And it's not just about cutting costs. They need to improve the quality of care they deliver, improve care coordination, make sure people have access to the right providers, and empower members to be active participants in their own health.
So a more comprehensive approach rather than just addressing symptoms as they pop up.
Exactly. And this is where technology can be a game changer. Humana needs to use data and analytics to identify areas for improvement, personalize care plans, and make it easier for members to get the information and resources they need.
Using tech to make healthcare more efficient, effective, and patient-centered, that sounds promising.
It could be, but tech is just a tool. It's up to Humana to use it wisely and ethically.
Which brings us back to those star ratings. They're not just about clinical outcomes. They also take into account things like customer service and member satisfaction. What can Humana do to raise those scores?
They need to make it easy for members to interact with them, whether it's online, through an app, or by having a responsive customer service team. They need to be proactive, keeping members informed about their benefits and helping them navigate the healthcare maze.
Building trust and transparency so members feel valued and involved in their healthcare journey.
Exactly. And it's not just about the members. They need to cultivate strong relationships with providers, too, and be seen as a collaborator, not just an insurance company focused on profits.
So fostering a sense of shared purpose and working together to achieve common goals. It sounds like healthcare can take a page from the diplomacy playbook.
Aha, maybe so. But seriously, I think Humana's success depends on their ability to navigate these challenges and seize opportunities in this rapidly changing healthcare landscape.
And for the rest of us, those of us who aren't running healthcare companies, what can we do to stay informed and advocate for a better system?
That's a great question, and we should all be asking it. First, stay informed. Read articles, listen to podcasts like this one, of course. Talk to your friends and family about the healthcare issues that matter to you. The more we understand how the system works, the better equipped we are to make smart choices and push for change.
Knowledge is power, right?
It really is. But it's only the first step. We have to use our voices. Contact your elected officials, share your stories, and demand a healthcare system that works for everyone.
Get involved, speak up, and make your voice heard. I think we can all agree on that.
Absolutely. And don't be afraid to ask questions, challenge assumptions, and think critically about the information you come across.
Be a smart consumer of healthcare news.
Exactly. Healthcare is constantly changing, and we each have a role to play in staying engaged, informed, and empowered.
That's a call to action we can all get behind.
And I think it's a good place to pause as we wrap up this part of our deep dive into Humana's roller coaster year. We've covered a lot, from the company's specific challenges to the larger trends shaping the entire industry.
This is just the beginning of the conversation. Keep those questions coming, keep learning, and keep pushing for a better healthcare system. And in the final part of our deep dive, we'll explore some even bigger questions about the future of healthcare in America. What are the possible scenarios? What are the risks and opportunities? And most importantly, what does it all mean for you? As we wrap up this deep dive into Humana's turbulent year, I keep coming back to one thought.
Let's hear it. What's got you pondering as we close out this episode?
Well, Humana's trying to make a comeback, right? But they're facing these forces that are way bigger than just one company. The entire healthcare system is in a state of flux.
It's like they're trying to navigate a ship through a hurricane. And it's not just Humana, it's the whole industry facing those gale force winds.
Exactly. And that hurricane, well, it's fueled by some pretty powerful trends that are changing the face of healthcare. We're talking an aging population, rising rates of chronic diseases, those ever-increasing drug costs. These are things no single company, no matter how big, can really control.
Sounds like we've got a perfect storm brewing in the healthcare world.
Yeah, you could definitely say that. And the fact that Humana, this major player, is actually shrinking itself to try and stay profitable, it really shows how intense the pressure is.
It's like that canary in the coal mine, right? If Humana's struggling this much, what does it mean for the smaller insurers, the ones with even fewer resources to weather the storm?
That's a question that keeps me up at night. It makes you wonder if the current healthcare model is even sustainable in the long run. Are we going to see a massive wave of consolidation with only a handful of giant insurers left standing? Or will we see a complete reinvention of the system?
I guess the future of healthcare is a bit of a mystery right now. Lots of potential paths it could take.
No doubt about it. And Humana's journey in 2024, it's just one chapter in that much bigger story.
That's why this deep dive has been so insightful. It's given us a glimpse into the forces that are shaping healthcare's future, not just for Humana, but for all of us.
We've uncovered the challenges, explored the potential solutions, and hopefully sparked some critical thinking about what it all means for you, the listener.
We've talked about rising costs, shrinking networks, the shift towards value-based care, the role of technology, the impact of politics, and that constant uncertainty hanging over everything.
It's a lot to process. But amidst all that complexity, one thing remains absolutely clear. Healthcare is personal. It's about your health, your well-being, your ability to get the care you need when you need it.
Couldn't agree more. And that's why we want to encourage you to stay informed, stay engaged, and stay empowered. Ask questions, challenge assumptions, and make sure your voice is heard.
Don't be afraid to advocate for your own health and for a healthcare system that truly works for everyone.
Because ultimately, the future of healthcare isn't something that just happens to us. It's something we actively shape, something we build together.
And on that note, we've reached the end of our deep dive into Humana's 2024 financial roller coaster. We've explored a lot, but this conversation is far from over.
Keep those questions coming, keep learning, and keep diving deep into the world of healthcare. Until next time.